We'll start the conference properly now with the Minister for Mental Wellbeing and Social Care, Mr Kevin Stewart. Unfortunately, he can't be here in person, but he's recorded a message that he wants to share with the conference. Thank you.
Good morning, and thank you for inviting me to take part in your conference today. I'm sorry that I can't be there in person, but I'm delighted to share this video with you instead. Self-directed support is one of the cornerstones of social care in Scotland. It is at the heart of ensuring people can choose the support that is right for them. And this annual conference is a platform for bringing people together to recognise and share good self-directed support practice, as well as enabling shared learning through expert panel and workshop sessions. Building strong relationships and making new connections with others involved in social care delivery attending this event will undoubtedly help to shape future delivery. And it's right that SDS is shaped by people who have lived and living experience of using it. And I'm confident that today's event will help us to continue to improve the way in which SDS is delivered. This is the only national conference with a focus on SDS. It not only brings those working in the sector together, but is unique in bringing together people with lived experience, their carers and support organisations, such as the Centres for Inclusive Living and Disabled People's organisations, so that we can reflect collectively on what has been achieved and what needs to be included in the further development of SDS. Much has changed since the last conference in 2021, most notably the introduction of the National Care Service Bill, but also publication of the revised SDS statutory guidance, the carer strategy, the SDS framework of standards, the establishment of the National SDS collaboration, and the Personal Assistant Programme Board, which reports on issues affecting personal assistance directly to me. SDS, more than ever, needs to be delivered in a way that is flexible and which helps people to make their own decisions and to have their voices and preferences heard. The flexibility that was applied to SDS during the pandemic was hugely valuable, and I want to see this kind of flexibility applied much more routinely across the whole of our country. The SDS Improvement Plan, developed jointly with COSLA and the SDS National Collaboration, is nearing completion and will set out our collective focus in the years leading up to the establishment of the National Care Service. This year's conference theme, Harnessing Momentum, reflects the ongoing positive work to build on recent progress to deliver our shared ambition of genuine choice and control for people. The role, and indeed the potential of SDS in achieving this, cannot be overstated. Today will give us a chance to look back at the positive impacts of SDS and to look ahead to what can be achieved through delivery of the SDS Improvement Plan. I recognise that the social care sector is currently facing unprecedented challenges, most notably issues around workforce and, of course, the cost of living crisis. Much of the levers to address these issues are beyond the control of the Scottish Government, but I am sure that by continuing to use platforms such as today's event to work collaboratively and collectively, we can and will improve on consistent delivery of SDS nationally. This will have real, tangible benefits for people who use SDS. I hope that you enjoy the conference today and that it not only strengthens existing relationships, but also encourages new relationships to share combined knowledge and expertise that will help us to shape the future. Thank you very much and have a good day.
Thanks very much, Mr Stewart. We're pleased to have the Minister's support today and pleased that SDS has such a high profile at present. We're also delighted to introduce Councillor Paul Kelly, the COSLA Spokesperson for Health and Social Care. We've been collaborating a lot with COSLA recently during the ongoing negotiations around the plans around the SDS Improvement Plan. It's the first time we've had COSLA at this conference, and we're really pleased that Councillor Kelly's been able to join us. He has been a councillor for the Motherwell West Ward of North Lanarkshire Council since 2007. He's currently the Deputy Leader of the Opposition Labour Group in the Council. From 2016 to 23, he was the Deputy Leader of North Lanarkshire Council, Non-Executive Director of NHS Lanarkshire, and then Chaired and Vice Chair of North Lanarkshire Health and Social Care Partnership Joint Integration Board. He was appointed to the role of COSLA's Health and Social Care Spokesperson after his re-election as Councillor in 2022. So I'll hand over to you, Councillor Kelly.
Good morning, and good morning, Donald and Beck, and thank you for that introduction. And being a councillor since 2007, it makes me realise I've been here quite a long time, so you suddenly realise that. I'm delighted to be here today, really delighted that COSLA's here today, and as you say, for the first time we've been represented, and I think it's really important with all the partnership work we have across yourself and many other organisations. And I'll just start really with a brief introduction to COSLA. COSLA is a councillor-led cross-party organisation and is the voice of local government. COSLA champions council's vital work and aims to secure the resources and democratic powers they need to build better and more equal local communities. COSLA focuses on the challenges and opportunities faced by local authorities and engages positively with governments and others on policy, funding and legislation. I'm really grateful to have been given the opportunity to speak to you all today at this SDS National Voice event and to be able to share COSLA's continued commitment to self-directed support and to its improvement. It's really great to see so many people in attendance today, and I think that reflects the wide interest and public and professional investment in the success of self-directed support. SDS legislation, as the Minister said, at its heart is person-centred care. It recognises the limits to a one-size-fits-all approach and reflects the fact that an individual's needs, their personal outcomes and priorities will be different from someone else's. People should therefore be as involved as they wish in the planning of their social care. Self-directed support means individuals having more choice and control over their support and how it's provided, and ensuring that their human rights are realised. COSLA is committed to supporting improvements that further embed SDS within services, systems and cultures, and committed to SDS being the way that social care is provided for adults, children and unpaid carers in Scotland. We recognise that this commitment has not yet transformed into SDS being the fully embedded, and that we have not yet got it right everywhere for everyone. The reasons for this are complex, and I think we all know the kinds of challenges being faced by the whole system, including an under-resourced social care sector resulting in increased levels of unmet need, workforce recruitment and retention challenges, staff burnout, the effects and after effects of the COVID-19 pandemic, as well as a changing demographic. For improvement work to succeed, the reality is Scotland needs to value care, and we need care to be valued now. Despite an increase in public focus on social care following the publication of the National Care Service Bill, just 10% of fresh health and social care funding announced in this year's Scottish Government budget is to go towards social care improvement. Of the fresh funding, we'll see 90% go to health and 10% to social care. This funding disparity and undervaluing of the role of social care in society will continue to hinder our collective effort to improve Scotland's care provision. Staff across social care and social work services have worked tirelessly to continue to deliver in the face of enormous pressure and challenges. Despite these challenges, councils across Scotland have been taking innovative and creative approaches to social care, including through using the flexibility of SDS legislation in collaboration with supported people, and where appropriate, their carers, to find approaches that work for them. Examples of this include non-traditional breaks for carers, such as materials for a hobby or membership of a class, support to employ a PA that can help a young person attend a sports club, and someone trying out one approach to their social care provision and then changing and adapting this based on their experiences. Local improvements are also consistently being made to systems, policy and processes, in response to the needs of the population and to reflect local authorities' continuous learning from their own SDS implementation and approaches shared by other local areas and stakeholders. On a national level, COSLA are involved in the national improvement work, including being involved in the development of the SDS framework of standards, co-publishing the SDS implementation plan for 2019-21, and working with various stakeholders on the development of an SDS improvement plan for 2023 to 2027. COSLA also participate in the SDS National Collaboration, Personal Assistance Programme Board, and SDS Project Board, and the important work of these groups helps to inform the priorities of the COSLA's Health and Social Care Board. Whilst COSLA and local authorities are focusing on improving SDS in its own right, we're also focusing on wider improvements, reflecting the fact that the success of SDS is intrinsically linked to the wider social care system, not separate to it. Much of this work is set out through COSLA and the Scottish Government's joint statement of intent, which includes a commitment to fair work, continuing to embed human rights in the provision of social care support, ending non-residential charges, ensuring people have a voice in how social care is delivered, and an overhaul of the current eligibility criteria. COSLA remain committed to the improvement of SDS and social care provision and will continue to work collaboratively with partners, including the Scottish Government, people with lived and living experience of SDS, carers, third sector organisations, professional bodies, and providers to ensure people's experiences of social care and SDS align with our shared expectations. I just want to end my remarks today by reflecting on the importance of sharing good practice and examples of where approaches have resulted in positive outcomes for people. There are many examples of where SDS has supported people to meet their personal outcomes, approaches that have helped meet someone's wish to have more independence in their life, or have worked well to support a carer to have that balance in their life they want. This is important for shared learning and improvement, ensuring people stay inspired and recognised, and ultimately to keep the momentum. And I wish you well for the rest of the conference. Thank you.